Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Lanette Siragusa, Chief Nursing Officer for Shared Health. I know media may have many questions for us today, so we'll keep our remarks short. Earlier today, it was announced the entire province of Manitoba is moving to critical or red on the pandemic response system, and additional restrictions will be added. And these will take effect Thursday at 12:01 a.m. and will last for a minimum of 2 weeks. The goal is to serve as a circuit breaker to stop the transmission of COVID in Manitoba, to reduce the number of connections between people, therefore reducing the amount of transmission. Our numbers have been going in the wrong direction for quite some time, and so we need to do whatever we can to reduce the numbers going forward. We're seeing that strain on our healthcare system, and if we continue along this trajectory, we're going to see increasing strains on that healthcare system. So this is a serious time, a critical juncture that we have to take specific steps right now to reduce the amount of transmission of this virus. I know at a time like this, many Manitobans are worried or scared, but we do have very concrete things that we can implement right now to reduce the transmission of this virus, to protect ourselves, the people around us, the people we love, protect our healthcare providers who are right on the front lines, putting themselves at risk, caring for Manitobans. And so we owe it to them to ensure we're doing whatever we can to decrease that strain on the healthcare system. And so we can take this personal action knowing that we're all in this together. So do not gather with people outside your household. This includes Remembrance Day. While this is an important day to remember and to send our respects and thank you to our veterans, we can't gather in large groups, even on an important day like this. Limit your social activity, stay at home as much as possible, send only one family out for essential tasks if possible, and continue to ask yourself, do you really need to go out? If it's not necessary, please stay at home. Reducing our overall contacts will be able to reduce the transmission of COVID-19 in Manitoba. As a province, we have the strength and ability to do this. We know that because we've done it before. We have flattened that curve very successfully in the first wave, and we'll do it again, but it'll take this concerted effort. We've put these restrictions in place because it's critical that we act now. And so as we see those numbers improve, we'll be able to, again, loosen these restrictions. We won't be back at normal for quite some time, but we will eventually be back to normal. I want to continue to remind everyone to be kind and respectful. It's difficult times, but it's difficult for everyone. We have these restrictions in place, and we know these upcoming weeks are going to be even more difficult for many Manitobans. But getting angry at a business owner or an employer who's just trying to follow the restrictions to protect other Manitobans isn't going to be useful. It doesn't help us get through this. We're all making sacrifices now to slow the spread and to reduce our numbers, to reduce the impact on the healthcare system, to ensure the healthcare system's there for Manitobans. So now is the time for compliance, compassion, and for sure kindness. If you're in public, remember to follow the rules and be respectful. If an employee or fellow patron reminds you of the rules, acknowledge that and acknowledge that we're all in this together. Wearing a mask in indoor public places is mandatory, and we continue to ask all Manitobans to do so. We are announcing 5 additional deaths due to COVID-19 today. A male in his 70s from the Winnipeg region, a female in her 90s from the Winnipeg region linked to the Victoria General Hospital outbreak, a female in her 80s from Winnipeg region linked to Maple's personal care home, a male in his 70s from Southern Santé Sud region, a female in her 80s from Winnipeg region linked to the Seine River retirement residence. I want to extend my condolences to family and loved ones during these difficult times. Our current 5-day test positivity rate is 10.6% provincially and 10% in Winnipeg. There are 384 new cases of the virus as of 9:30 a.m. this morning. One case had been removed due to being out of province, so the net new increase is 383, bringing our total number of cases to 8,878. These are unprecedented times. This is a 100-year pandemic that we're all trying to navigate our way through. And so it's challenging for all Manitobans. But we know what's needed to reduce the spread of this virus, and we've done this before. And we know that the time is now. We need to maintain the ability of our healthcare system to care for Manitobans. It's very difficult to give a lot of things up that we love. It is a short period of time. And so with our focused efforts together, we'll be able to see these numbers coming down. But we need to take these steps now. We're at a critical point. So again, we're going to together bend this curve. With the holiday on Wednesday, there'll be a bulletin only. No press conference is expected on that day. And so thank you to all Manitobans. And I'm going to pass it over to Lanette.
Thank you. Good afternoon. Across Manitoba, physicians, nurses, healthcare aides, and allied health professionals and other staff are working to expand the capacity of our acute care facilities in order to manage the surge of patients in need of hospitalization. Within personal care homes, staff are similarly responding to a sharp increase in the number of COVID-positive residents and their increased needs. And this is occurring while many staff are isolating due to exposures or symptoms, or because they have been confirmed COVID positive, some as a result of community transmission. Our health system is under the strain of widespread community transmission of this virus. Healthcare workers are responding to this challenge in the way that they always do, by problem solving, innovating, and working together. But we are the backup plan for the public health measures. Our hospitals and our providers are the safety net, and we must protect their ability to care for the Manitobans who need our help, whether it's related to COVID or any other illness. Without the immediate reversal of the current trend of community spread, our health system will continue to be strained. Please do your part while we do ours. As hospitalizations rise, we continue to add capacity and convert beds to medicine and critical care, not just in Winnipeg, but throughout all of Manitoba. As of midnight, 89 ICU beds were open, 81 were in use, and 30 of those beds were occupied by COVID-19 patients. 22 of the 73 patients on ventilators this morning were COVID positive. 4 more ICU beds were added to the system yesterday at the Grace Hospital, bringing our number to 89. Since the end of October, we have added 12 beds to our overall ICU capacity and are planning for more. We also are expanding medicine beds throughout the province, and that means adding capacity where there wasn't any previously, but it also means converting surgical beds for medical patients. So with those measures in place, we still have capacity for medicine, but it is ongoing effort to keep adding so that we can manage the influx. Since October 26th, 449 non-urgent and elective surgeries have been postponed as part of our slowdown, and further slowdowns are being considered throughout the province. Hospital capacity will continue to be increased in stages as required. The other area that has been very busy is our alternative isolation accommodation program sites. So as you recall, these sites are provide a safe place for people to isolate if they have COVID or they're suspected of having COVID or they're a contact or they can't safely isolate in their homes. We have the hotel site, which has been very busy, accepting 37 people into the program in the last 7 days. And as of yesterday, there were 51 people staying in the hotel for isolation. Our shelter site, which is for those who are experiencing homelessness, also very busy, reached capacity last Thursday and has remained at full capacity ever since. As of Monday, there were 39 referrals that had been accepted into that shelter program over the past week. With this primary shelter site full, we have also now opened up a secondary isolation space to help these individuals safely isolate. And as of the current numbers are 9 clients have been accepted into this site, the secondary shelter site. In the north, isolation sites have been created in different locations. 32 people are currently in isolation at locations throughout the region. And an isolation site has been set up and operated by the Canadian Red Cross, very busy too, with 66 people staying at their site. So we are starting to feel the compression in the system. And so we want to thank all the Manitobans who are doing what we need to contain this virus and stop the spread. And we thank everyone who's working really hard and our healthcare workers especially for everything that you do. And with that, we can open up to questions.
Thank you. A reminder to our reporters on the line this afternoon, you will have 1 preliminary and 2 follow-up questions. Up first, from the Winnipeg Sun, Scott.
Good afternoon to you both. Scott Bill, Winnipeg Sun. Dr. Roussin, you mentioned panic buying, I believe, earlier, stockpiling that they saw in the spring. What is the message for people tempted to kind of do that again? And are there any suggestions for even grocery stores on how to best manage that?
Yeah, so the message is clear: is that it's not required. Right, our supply chains are very strong. We have all of these critical services will continue to be open, so no panic buying or hoarding is required. Certainly, when people go out, we do encourage send the least amount of people out of your household to do this this shopping. If it can be only one person, that's ideal. To stores, I don't really have their specific guidance other than to ensure that the occupancy limits are maintained. Lots of access to hand sanitizer, reminding patrons to use masks, and they can deal with their own operations, but yeah, definitely measures against stockpiling are good because it's definitely not needed.
Okay, thanks. First follow-up. What is the message for those right now struggling with mental health and those who will likely now have to isolate themselves further? It's a tough time for anybody dealing with that. What are the suggestions, messages for that population of people that are gonna, today would be, a bit of a downer, I suppose, for lack of a better term.
Yeah, and you're right. It's challenging times for probably all Manitobans, especially with those dealing with mental illness. And so we do have resources available. I would encourage them to go to our website, manitoba.ca/COVID-19. There's counseling sessions available. There's some cognitive behavioral therapy sessions that are available through that. Continue to see their healthcare providers. And this is a message, again, that we want to clarify very early on, that seeking healthcare is safe. If you need to see your healthcare provider, if you need to go to hospital, it is safe. Please do so. If you need to seek healthcare, don't be deterred from seeking healthcare. Now, primary care providers have access to virtual visits as well. So there's still access out there. Please, if you need to access healthcare, do not hesitate. It's safe to do so, and I encourage all Manitobans to stay in touch with their healthcare providers.
Thanks. Just my final follow-up. Is public health looking into allegations that 2 Winnipeg-based Manitoba Junior Hockey League teams held practices outside of the red zone in an attempt to flout the rules?
Well, I know if we don't have any details on that. This is, not specifically that, but we've heard of a number of those instances related, not necessarily specifically to sports teams, but again, it's that messaging that we know it's difficult, but these rules are in place to protect yourself, the people around you, all Manitobans. And everything that we do to try to work outside of these rules is actually putting everyone at risk. It probably doesn't feel that way to people because they're tired of the restrictions. They may feel safe, but anyone who tries to work outside these rules right now, you're putting other Manitobans at risk. So we know it's difficult. It's going to be a short term, but we all need to step up right now and bring down these numbers.
From CBC Radio Canada, Emily.
Hello, Emily from Radio Canada. Just a question. We heard that there was a healthcare worker who died from COVID in Southern Health Central Region. Could you please confirm that, and maybe if you had any more details on this death?
Yeah, we cannot confirm that or have details at this time.
Okay. And also, I was wondering if maybe there was any news regarding the death of the other healthcare worker this time in Winnipeg last week on Friday. Do you have anything to communicate with us today? Because I know that the family had a lot of questions regarding this death.
Yeah, if there's any questions from the family, they should be directed to the Winnipeg Regional Health Authority. They would have those details available. I have no further updates on that myself.
Mm-hmm. And for last questions, we heard for a long time from doctors and even other healthcare professionals that they were calling on the province to take further restriction and to have those kind of measures put in place to stop the transmission of the virus. Do you think the red code coming in place on Thursday is not too late for you?
No, I mean, I think that we've been in red for a little over a week now in Winnipeg. We put further restrictions on. I think certainly the trends are in the wrong direction. But as we hear, as we all know, is that these restrictions are not without significant impacts either. So we always have to go with the least restrictive means that can get our desired effect. And we know that these restrictions are going to be very difficult for Manitobans. But like we hear from a lot of those healthcare providers who we're relying on their support now again, that these restrictions are necessary. We need to flatten this curve. We need to decrease the strain on our healthcare system. And where we're at right now, the only way to do that is this circuit breaker. And so, moving forward, we're going to start seeing these numbers come down, but they are necessary right now, these restrictions.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. You stated earlier that you think these will be in place for 4 weeks, and you said here they'll be in place for a minimum of 2 weeks. what metrics would you have to see in order to relax some of the restrictions? What kinds of test positivity rates, caseloads? Can you provide some degree of specifics or generality?
Yeah, so I mean, I think we should plan for 4 weeks, but absolutely a minimum of 2 weeks. The metrics are the things that you've heard us talk about. We're going to see that test positivity decline, and we're going to need to see that coming. If we're going to lift these early, we'd have to see a dramatic decline in that to that 3% or less. We'd have to see our overall case numbers dramatically decline. We certainly can't continue a trend with 300 or 400 cases a day. We'd have to see a dramatic decline in that. And then, of course, we're going to have to see our healthcare system not under strain. And so a number of things we're going to look at. I think we need to prepare for those 2 incubation periods. But of course, if we saw some dramatic improvements early on, then we could review that and see where we could lift some restrictions.
Thank you very much for that. Ms. Siragusa, yesterday I asked you about healthcare aides being trained to take vitals. You stated it's actually relatively easy given some of the technology now. That led healthcare workers to contact me and let me know that it's not the use of the device, but the interpretation that is technical. Could you comment on that, please?
Well, I believe I did say that yesterday, that is the nurse or whoever the regulated healthcare professional is the one that would have to be aware of what the vital signs are, what the trends are, and put together the big picture of what's happening with any patient. So in the plan that we have, certainly we wouldn't put anyone in a situation where they didn't have the skills or the competency to do the task, but it is also going to be really important, the communication, having regular huddles, making sure that everybody's informed so that there's no gaps and safety remains always the top priority. So exactly like you said, Bart, that someone can do a task and press a button on a blood pressure machine. There would be no expectation that that person was to manage that. It would be the expectation that that person communicate and that the care provider, the regulated health professional, is accountable and responsible.
Thank you for that. Thank you. I must have misunderstood yesterday. I appreciate that. No one more question for Dr. Roussin. Earlier, the Premier said that he was asked whether the military should come in, and he said that would diminish Manitobans' faith and suggested that would offend you. So I'm going to ask you yes or no if the presence of the military at Maples or Parkview would actually offend you.
Well, I mean, none of this is about me, right? And I don't think that that's the issue at all. So I think that the message is that we have plans in place. Certainly, the things we've heard, and we're going to be discovering more and more, information is they're unacceptable, from what we've heard there. But I think that we have the plans in place and the people in place so that we don't require assistance from the military, certainly not at this point.
From CTV Winnipeg, Michelle.
Good morning, or not morning, good afternoon. I'm wondering what is the expectation? Will the case numbers get worse before they get better, and how is the healthcare system preparing for that?
So as far as the numbers go, remember we're just on the cusp now of the goal was to see some benefits from the first level of red in the Winnipeg metropolitan region. So we don't expect a dramatic increase in cases in the Winnipeg area over the next little bit. Because we had already been in a red area. We just weren't seeing the early indicators that showed us we were going to see a decline fast enough. So now with these new restrictions in place, Probably as early as a week, we can start seeing some beneficial numbers come. So as far as the healthcare system preparing, I can let Lanette discuss that.
It's ongoing preparations, so we will continue to monitor, well, as people come in, depending on where they go, if they're going to medicine, if they're going to critical care. We've already started orientating people to critical care and medicine, looking at their skills and getting them orientated to the area and the team. We've already been introducing some changes in models of care, and it's been lots of positive feedback in terms of what we just spoke about with Bartley, is having those regular touch points and communication so the whole team feels informed and supported. The surgeries, the bed capacity, the finding new spaces, that will continue until we start seeing a change in the flow of patients coming in and a change in the acute active cases in Manitoba.
Okay, thank you. Also, I'm wondering, is there any plans for increased testing or hiring more people for contact tracing to go along with these public health measures?
As far as testing goes, that's always something that's being worked on. Again, there's a lot of issues with the global supply of things like reagents, so that's something that's always being looked at. For contact tracing, yes, they have expanded our capacity to do contact tracing. We now have Canadian Red Cross assisting our contact tracers, Stats Can on board, and further training and expansions planned even for this week too.
And my last question is about travel. You're saying to Manitobans kind of don't go anywhere. But is anything going to change for people who might travel here that we did before?
Right, not at this point. Right now, our numbers are higher than most other spots in Canada. So the epidemiology doesn't really guide us to restrict travel in that manner. Our numbers in our recent cases related to travel are quite low. So right now we're going to focus on reducing our contacts. Anyone certainly traveling here will have to be following these public health orders, which will reduce their contacts. And we'll see these numbers coming down. Nothing's ever off the table, but right now we don't have any further travel restrictions other than the northern travel restrictions.
From City News, Stephanie.
Hi there, Stephanie Lasuk with City News. And I just wanted to ask you again, of the ICU numbers that you relayed to us today, how many of those are here in Winnipeg?
Let me see. Don't know. I don't have those with me, sorry.
Okay, have we seen cases where COVID patients are being transported outside of Winnipeg to ICU beds, or cases where doctors are forced to make the decision of who to put on a ventilator or into an ICU bed?
No, not to my knowledge. There has not had to be decisions like that. There may be, the ICU team meets every single day and has a discussion about who's transferring in, who's transferring out, the acuity needs. There may, and this has always been standard process, that some patients may be transferred to Brandon or vice versa, depending on the patient's needs. So that may have happened, but that's not an extraordinary circumstance. It would just be, I think, more business as usual.
Okay, and just can you give us any kind of firm goal of how many ICU beds you guys hope to have in 2 weeks by the end of the month kind of thing? Do you have any, I guess, firm numbers on those?
Well, we're expanding as the patients come in and require. So it's a supply and demand. So it's our goal to keep expanding as long as we have to ensure that we have what patients need. So I wish I could, I don't have a crystal ball. It could be 5, it could be 20. It depends on how people who have COVID are responding and what their healthcare needs are.
Okay, thank you.
From CHVN, Taylor.
Hi, good afternoon. What do these new restrictions mean for families with split custody?
Right. So these in all of our orders, even on our travel orders, those were exempt. So it really wouldn't mean anything specifically to those. Remember, we talk about socializing. We want to be only socializing within our household. This doesn't apply to people who may have parents or friends come for childcare or other supports and things. So it's really the non-essential. Socializing is really what we're trying to get at here, but shared custody would go on unchanged.
And what about when it comes to things like grandparents, significant others, adult children? Are those considered social gatherings?
You know what? Like our advice is, household, keep your contacts to your household members when all possible. So if it's an essential visit, you're caring for your parents, or child care arrangements, this would be essential. If it's just to socialize, to visit, I would encourage doing so virtually for this relatively short period of time. We have to keep our contacts down, and that protects all those loved ones. The less contacts they have with others, the safer they'll be.
And for people, for even households who feel like they need to include other people in their household, is that a potentially okay idea to merge different households during this time?
I wouldn't suggest it right now. Right now, the suggestion is socialize only within your household contacts. Leave your house for essential purposes. And otherwise find creative ways, right? So it's, social distancing, not social isolation. Keep in contact with others. Make sure you're reaching out to family and friends, especially if they're feeling isolated. But we should try to keep our social interactions, in-person social interactions, to our household members for this upcoming weeks.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, I'd like to know, how are you feeling knowing that Rivera has been less than accurate in its reporting to the WRHA about its operations? And do you think this lack of disclosure has frustrated public health, the efforts of public health to control outbreaks at Maples and Parkview Place?
You know what? I think it's obviously unacceptable, right? It's not something as Manitobans we can accept, and so we're the minister announced further measures, further investigations that are going to go on. So we're going to find out more. But absolutely, we're our goal with this pandemic response is to minimize severe outcomes. And to protect our most vulnerable groups, and we know that our people in personal care homes are one of those groups, our most vulnerable group, and so we owe it to those Manitobans and their families to do what we can to protect them. And hearing news like that is certainly disturbing. But we'll, moving forward, we're going to ensure we're getting all the right information we need. The region is involved, and we're going to try to do whatever we can to keep protecting those vulnerable Manitobans.
Okay, thank you very much. And you didn't provide Headingley numbers today, and I'm going to hazard a guess that perhaps those numbers are continuing to rise. At least that's been the case at that jail. How concerns you about the ability for that outbreak to be contained and the impact it might have on the health system?
Yeah, and so we have a total of 185 cases at Headingley, 38 staff, 147 non-staff, 93 of which are active in total. And so we just know in these settings, right, that this is how this virus spreads with indoor prolonged contact. And so we have to focus on doing whatever we can to not introduce that virus into these type of settings. But anytime you see that many cases, certainly we're concerned, do whatever we can to limit the transmission. Thankfully at this point, we haven't seen any severe outcomes related to that outbreak. But we want to, continue to do whatever we can to prevent future outbreaks and to limit the spread during this one.
And I'm going to ask about the technologist choice masks. So the company that makes those, they don't recommend that they be used after 5 years of the manufacture date. And they say that they do not have data or test results to support the extension of their shelf life, even in controlled temperatures. Why is Manitoba standing by the fact that these masks are safe, and what evidence is there to back this claim?
My understanding is those are being recalled, I believe, and will be replaced. So I'm not sure that Manitoba backs them. We want our people to be safe, and those were sent out, and they're coming back. And I believe communication will be going out from the government departments accordingly.
From Global, Amber.
Hi. So with the restrictions that are coming into place, if people, for example, see someone outside their household, is there going to be a fine? Are there consequences for this at all?
Well, certainly the group sizes are in effect, and we expect to enforce these orders. Again, it's within reason. We're not trying to prevent people coming over to care for their family members or for childcare reasons. We're not preventing people from going out and enjoying the outdoors. But just those group sizes have to be under 5, and for these upcoming weeks, we were just really advising Manitobans that they should reduce their contacts to their household members and any other essential purposes.
Our newsroom is a little bit confused about the Maples care home death numbers. Can you tell us exactly how many people have died from COVID-19 specifically at Maples?
So yeah, we'll get that. We'll be able to provide that for you then. So remember that when we provide our numbers, it's related to what's in our public health information management system, and so it needs to be updated there to provide. So we'll be able to report that to you.
Okay, and this one's kind of an odd one. We've been hearing reports that people have a scheduled COVID test and they don't show up. They're being told they automatically have a positive result. Is this true, or are you guys hearing about this?
No.
I haven't heard of it. That doesn't sound right, but we will definitely follow up. So thank you for raising that.
From the Brandon Sun, Emily.
Good afternoon. My first question is for Dr. Roussin. Can you tell me what the current 5-day test positivity rate is for the Prairie Mountain Health Region?
Yes. So again, we don't like reporting on the rural regions just because the denominator is so low. So you can imagine that just a small change in numbers or a small change in the amount of people who went for a test can add to the variability on that. Just even day by day. So today it's 5.3%. But again, we don't frequently publish the rural regions just because there's so much variability. Just a couple less cases tomorrow, or a couple more cases, or a few less people go for tests. There's a lot of variability in that number.
Understandable. What is the current wait time that it takes to receive COVID-19 test results? Like from someone going in for sample collection, when that person will be informed about their test result?
So that is a difficult question because it's hard to measure when somebody was informed. What we can talk about is that the time from the test to the result being posted or provided. And so that was around the 72-hour mark earlier in the week. That has been declining into the high 60s. I don't have an updated number today, but that's what we refer to as a total test turnaround. And again, that's a median time.
Okay, and do you provide some specific guidelines or more specific guidelines for people in Manitoba that live alone? Could two people who live alone and are limiting their contacts, essentially not seeing any other people, could those two people that live alone form kind of a household bubble, for example?
Yeah, and so this is, we run into this with all the restrictions and advice is do we want a black and white answer, or do you want that ability to have a gray zone response? So the black and white answer is no. The black and white answer is limit your contacts in person to household members. Right? A specific situation like that, the one that you just described, is certainly a very low risk situation, but there's a myriad of situations to go through. So the black and white answer is keep your in-person contacts to your household, and then certainly follow all of the public health orders.
Okay, thank you.
From CJOB, Will.
Good afternoon, everybody. Dr. Roussin, regarding the new restrictions announced today, we're still getting a number of questions regarding services such as massages, dentistry, physiotherapy, to name a few. So can you just set the record straight on how these are being impacted, please?
Right, so these are all examples of regulated health professionals. And so we have not had the orders applied to them. So each of those health professions certainly can seek advice if they have advice from public health, but we'll let those regulators regulate their professions and ensure Manitobans still have access to therapeutic services, but these orders don't specifically affect them.
Okay, thank you for that. We've had another day here north of 300 new cases, and I have to ask, where are these cases coming from exactly, and why are they increasing so dramatically, especially considering places like Winnipeg have already been facing tighter restrictions for a number of weeks?
Yeah, and so I think that's why we've continued to move in the Winnipeg region. The orange levels that we had sure didn't appear to be effective. Based on the numbers. The red that we did last Monday, we're just sort of on the cusp of where we might start seeing some benefit from it now. So still the majority of cases are coming from the Winnipeg region, so over 200 of today's cases were from the Winnipeg region, but we've also seen it in southern Santé Sud region, where we have implemented the red restricted that came in effect just Monday. Now, of course, it's throughout the province, but we do see it in all regions. The majority of cases are still in Winnipeg.
Okay, thank you. Another number of jurisdictions have had to go into second lockdown, but in your opinion, was a second lockdown inevitable? And if not, where and when did we go wrong?
Yeah, I mean, it's hard to think of things as inevitable. We don't know a lot about second waves in this virus, right? This is we dealt with the first wave. We know in pandemics there often is a second wave. It's often worse than the first. So we're preparing, and so the healthcare system was prepared to be responding to levels like this in March, and so we still have those plans in place. I think what happened is that this is a dangerous virus, and you can't let your guards down, and it's very difficult to keep your guard up for 8 months. And so what happened was we saw some success in the summer, but in a lot of ways, Manitobans and people around the world really tried to get back to as much normal as possible. And then what happens is where people gather, we're going to see this virus spread. So we saw that continually in our epidemiology, that where we had just a few contacts per case early on, and most of those contacts were household contacts, to now seeing people with 60 contacts. All outside their household. And so it's just, it's the nature of this virus. The more contacts you have, the more secondary cases we're gonna see. So these restrictions, this circuit breaker is gonna really affect that level of transmission, and we're gonna start seeing these numbers come down.
From the Manitoba Cooperator, Alexis. From the Manitoba Cooperator, Alexis.
Sorry, I forgot to unmute. Good afternoon, everyone. I'd just like to ask a question about the Roquette Pea processing plant in Portage-la-Prairie. Yesterday, there was an anonymous report that there were some issues at that construction site and that Manitoba Health was aware of them. Now, the company has refuted those and said that any improvement orders that have been handed down to the site are either have been addressed or are close to being addressed. I'm just wondering if you can offer any clarification around the status of that site.
Yeah, I don't have any details on that site, or about any orders that were provided. Certainly no public health orders from myself were provided there, so I don't have any details.
I guess this is a follow-up question, maybe in more general terms. Can you provide any context in terms of if the sector does note an issue at a work site, how is sort of the appropriate level of response determined in terms of if a shutdown is needed or if that site can continue to work under an improvement order?
Yeah, and so usually it's depending on the sector that's involved. There's usually a number of agencies that are involved. We saw earlier on we had some food processing plants that were affected. We had workplace safety and health, public health, CFIA, Manitoba Agriculture, all involved. So it really depends on the sector and the circumstances. So it's usually a number of agencies involved in ensuring that things are safe.
Thank you. As a final follow-up question, with the move to red and the new restrictions coming in, not only with the Roquette site, but with other similar construction sites for some of these agribusiness processors that the agriculture sector has been told to look forward to in the near future, those sites, because they're connected with agribusiness, do they meet the requirement for the exemption and continue to go forward, or are they looking at a shutdown?
Right. So agriculture-related businesses are listed in the critical services. Construction is listed in the critical services in that manner. So they would still be allowed to operate within the orders.
Thank you, everyone. This concludes today's media briefing.